Hi, I'm Paul Richards from the Australian Academy of Science. We know there's a need for credible and up-to-date information right now on COVID-19. So 3 times a week, we'll be interviewing leading scientists so you can have a better sense of what's happening. And this is also a chance for you to ask questions that you want answered. You can send us a direct message via Facebook, tweet us your question using the hashtag #AskAScientist, or by visiting our website. The views expressed in these web shows are those of the experts we interview, all renowned in their field. So joining me now is Fellow of the Australian Academy of Science, Professor Ian Frazer, who is also from the University of Queensland and a past president of the Australian Academy of Health and Medical Science. Welcome, Ian.
Good morning, Paul.
Can you explain the situation that Australia is currently in?
We are at the same stage in the epidemic as many countries globally, but we're well behind countries like China, Italy, France and Spain. And we're in the process now of trying to put in place measures to make sure that we are best placed to look after people as they get this illness.
How likely is it that many of us could end up catching this virus? We're seeing numbers reported in the media that seem to be climbing. What's your view?
The best evidence suggests that the majority of us over the course of the next 2 years will acquire infection with this virus. That, of course, does not mean that we'll become ill with it. Indeed, the vast majority of people that get the virus infection do not seem to have any symptoms at all. But about 40% of people who get the virus will get a flu-like illness. Less than 1% of people who get the virus will end up with a serious complication requiring intensive care.
How is COVID-19 different from what you can see compared to other viruses that we've seen in the past?
Well, in a way, it's very similar to the other viruses of the coronavirus family, which we know quite a lot about because we've been studying them for many years. Coronaviruses cause a common cold, and this is a virus, the new virus, which infects the airways in much the same way as the cold virus does. The difference is that for a very small percentage of people who get the infection, it causes nasty inflammation in the lungs, which can be eventually serious or fatal if it goes on without control. But that's a very rare complication of the infection. Otherwise, this coronavirus models pretty much like the other ones that we know about, in that it starts with spreading from an animal, it gets into the human population. After a number of infections through different humans, it becomes less infectious, and there's already evidence that that's happening with this new coronavirus, as it's happened with the other coronaviruses that have caused epidemics in the past.
There's been a lot of talk about flattening the curve. Can you explain, just to begin with, what that means?
Well, the aim of the measures that people have put in place to control coronavirus spread in the community are aimed at making sure we don't get a huge peak of ill people right at the beginning of the epidemic, as happened in China and apparently has happened in Italy, where the medical system has become overloaded with seriously ill patients and unable to cope with these. So that to flatten the curve, what that means is we want to slow the spread of the virus through the community. And that's why the government has, in my opinion, sensibly put in measures designed to do that, such as not going to places where there are large crowds, where one person coughing can infect several hundred people. And also this practice of social distancing, which it recognises that we're not likely to catch the infection just from passing somebody in the street, but you have to be in close contact with them for a reasonable period of time, up to 10 to 15 minutes, to have a significant chance of catching the virus. So social distancing, hand washing to make sure that the virus doesn't end up on surfaces that we can then pick up, and avoiding large crowds will slow the spread of infection through the community. And therefore, instead of having a short, sharp peak where the hospitals are overloaded, we'll have a slow, flat peak where the hospital system can cope.
We've seen a lot of similar steps taken by countries across the world, but there are some differences. Why are measures different from country to country in relation to trying to do that flattening of the curve?
Well, it's partly the country, partly the way that the health system works, and partly the ability of people to be controlled. In China, there was an adoption of lockdown policy, which certainly stopped the spread of the virus, but a very considerable impact on the economy and on the health of the individuals who were being locked down for long periods of time who didn't get the virus. And it's not yet proven in China that that stopped the spread of the virus, merely that it has stopped it temporarily. But now there are a lot of people who have not yet seen the virus there, who could potentially start a second epidemic there. In some countries, the measures that we have put in place early in the epidemic were not put in place until late in the epidemic, and they are now seeing the consequences of that. And in some countries, there's a much lesser availability of intensive care than, for example, there is in Australia, where we're relatively well supplied with intensive care beds relative to our population. Equally, social things differ too. In some countries, where both people in a family are regularly working, the babysitting, if you like, for the children is done by the grandparents. And so when the children get the infection, then they don't get sick. They can pass it on to the grandparents who are more vulnerable to infection. And so you see a larger epidemic. So each country has its own solution to the problems. None of them have been proven to stop the spread of the virus. The virus spreads wherever we are. It just has a different impact on when people get the infection and which people get the infection where in the epidemic.
It's quite extraordinary, isn't it? We're talking not just about health impacts with this virus. We're talking about massive economic impacts, social impacts, mental health. What are your concerns from an expert's point of view in relation to mental health?
Well, we know that social isolation is an extremely effective way of inducing mental health problems in people that are prone that way. That's been tested many times and used as a punishment even in some places, so that we really don't want the social consequences of this virus to exceed the physical consequences, and therefore we have to have a balance in the way that we manage it in the community. I think we're very fortunate that we've been able to make decisions early in the course of the epidemic in this country. They won't, as I say, stop the spread of the virus through the community. Eventually that will happen, but we can do it in a way that will minimise the impact on society in general and individuals in particular.
Now, you've personally been heavily involved in the development of vaccines in the past. What's your take on the development of a vaccine for this virus, where a lot of what we're hearing is it could take months, perhaps even a year or more? Why is that?
Well, the big challenge with developing a vaccine is not so much to start off with what you want to put in the bottle, but to actually get through all the processes that are necessary to show that it works, it's safe, and it can be produced in large quantities. And we don't have much in the way of vaccine manufacturing capacity in Australia. We never have had. We've relied on importing vaccines. But also we recognise that to build the pipeline that takes a likely vaccine out there into the market, even if you want to do it as fast as you possibly can while making sure it's safe, is a process which is going to take a year or so. And we don't yet have something that we know works and that we can put into the pipeline. We know people are developing them, but I would estimate that this pandemic will be probably well and truly over before we have a working vaccine.
Okay, that's really interesting information. That's not something that I had clearly understood, whether we would have these social isolation or social distancing measures in place perhaps until a vaccine is developed. Are you saying that the virus could actually subside in its impact on the community before then?
Yes, it's quite probable that that will be the case. I mean, we don't know. I mean, we could come up with a vaccine which we believe works tomorrow, but even if we did, realistically, to make enough in Australia for Australia would be going to take at least a year.
I have a couple of final questions for you. China, we've seen, because the virus originated there, are now having fewer cases than they have had in the past. Is that a good sign? Is that a sign that the virus and crisis could be coming to an end there, or could there be another spike?
Well, we don't know is the short answer. We know that they have practiced very rigorous social isolation, and that flattened out the curve and effectively seems to have stopped spread within Wuhan now. How many other people in China are still vulnerable to this infection, we have no idea, because we have no test of who has already been exposed to the virus. We would really like to have a test that says this person's been exposed and now they're immune, but we don't have such a test. And we don't even really know how long immunity might last after you've had the infection. There have been a couple of cases reported of second infection infections in people that have already had the virus. It's possible that the majority of us will become immune once we've seen the virus, whether we got sick or not. That's modelling on the other coronaviruses that we know about. But these are viruses which don't infect the whole body, they just infect the surface linings of our lungs. And the viruses that produce long-term immunity tend to be the ones that spread through our bloodstream, which this one doesn't do.
Really fascinating. Just finally then, what can we learn from the way that China has handled its response to the virus as Australians?
Well, we've learned that we need to have adequate healthcare facilities available to look after people who get really sick. And we also have learned that social isolation is pretty drastic for people, but social distancing would be equally as effective for stopping the spread of the virus. And it's not going to stop it completely, we just need to slow it down.
Professor Ian Frazer, thanks for your time.
Thank you for that.
A reminder, you can ask your questions by sending us a direct message on Facebook, sending a tweet using the hashtag #AskAScientist, or visiting our website, where you'll also find more content about COVID-19 and watch a replay of this webcast.